Good to see you, Nicola. There are lots of questions there. The first one, do we know more about how we contract the virus and how we're infected?
Well, the research from the WHO still stands, which is basically if an infected person sneezes, coughs or speaks near you, then you're at risk of contracting the virus from them. Also, if you touch contaminated surfaces and then you touch your mouth or your nose or your eyes, and that's why we're all encouraged to wash our hands as much as possible. There's certainly question marks about whether the virus is airborne or not. There was a study in the magazine, the publication Nature, that showed that it can be in certain settings, such as hospital settings, which is why health workers are wearing protective gear. But whether this is happening in a wider environment and how far is still being studied by the scientists. And of course, this is why we're being told to keep that physical distance from people. Here in the UK, it's the 2-metre distance. The WHO is recommending 1 metre. I was speaking to Professor Ian Briley, who's a virologist from Cambridge University, and he says because, of course, if you cough or if you sneeze, those droplets go a bit further. So he advocates keeping 2 metres away from people. He says he certainly is.
Now let's talk about the workplace. I'm working. We're working here in a newsroom. We have less people. We have. I'll just give you a quick idea, and also to our audience. We have thermal temperature gauges as we walk in. We have automatic soap dispensers. Our offices, our studios are sprayed constantly and overnight. But what are the worries with regards to the workplaces, and are they safer than going into shops, for example?
Well, it seems as though you're taking, TRT World is taking as many precautions as it possibly can. Professor Briley, he's a virologist at Cambridge University, and he says that at the moment, his is one of the few teams that are still working. So they're spreading out like you're doing. They're making sure that all the surfaces are wiped down with 70% ethanol daily to kill any germs. But, is that enough? Once more and more people go back to work, you've got narrow corridors. Now, are they going to have to introduce one-way systems? Because, of course, you can't have people squeezing past each other. I've also been speaking to public health expert Linda Bold, and she was saying that what many workplaces should perhaps be thinking of is introducing perspex screens. Now, here in the UK, we've got those in front of cashiers in shops. But she suggests that maybe in offices you should have those between each desk. It's important that that physical distancing continues, so you can't socialise with your colleagues. For example, she says you shouldn't go and sit on a desk. You shouldn't share pens, which as journalists we tend to do far too often. Shouldn't share coffee cups, and not really have those water cooler moments when you sort of sit and chat next to each other. Whether shops or restaurants are going to be less safe is obviously depends on the precautions that they take. Now, the larger shops here in the UK have got people queuing outside 2 metres apart. They have a fewer numbers of people coming into the shop at a time, and they are introducing this one-way system. The small shops are minimising the numbers of people, so just 2 or 3 coming in each time.
There's a lot to think about, isn't there, Nicola? And just on the question of water coolers, ours were taken away, and we're constantly seeing new ways to protect us being introduced. Even our studio is disinfected. I don't share a pen, I have my own, but I'm constantly thinking about ways to be safer and to protect myself and my colleagues. Back to transport. What's the best method right now? Is it a bus? Is it a train? Surely ventilation, fresh air is an important factor as well.
Very much so. Professor Briley said that he'd rather take a bus at the moment because you can open the windows and have that ventilation. Train, I said, well, that's fine, but obviously in the winter that's not going to be the way. We're showing pictures of the tube stations in London. This is what they used to look like. Nobody is going to want to travel like that at the moment because you've not got that physical distancing in place. In fact, the best idea, if you can, is apparently to cycle, and they are making lots of changes so that more people can start cycling. But obviously, if you work an hour away, you're not going to be able to do that necessarily. So, of course, it depends on whether public transport is going to insist on people wearing masks, which I know is happening in many countries, and we're expecting that to be introduced here in the UK next week. And keeping that distance, putting on more trains, more buses, so that those pictures that you're seeing, and I have to say that we have to unveil often in London, are not going to be the pattern in the future.
Nicola, those pictures of the tube in London are one that I remember very well. Thank you so much for that. Nicola Hill, our health correspondent in London.